Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before caring for the person with Alzheimer's disease and other dementias, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene, identify the patient, and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Good morning. I'm Robin, your nurse assistant. I'm going to be taking care of you this morning. May I ask you to tell me your full name and date of birth?
Maureen Aldridge.
Very good.
May 5th, 1946.
Wonderful. Thank you so much. Thank you so much. I'm going to help you get ready for breakfast, okay? I'm going to go and get the tray and get things set up. Is there anything I can get for you in the meantime?
No.
Okay.
Thank you.
Okay. Your call light's right next to you. See the red button?
Mm-hmm.
Okay. I'll check on you in just a couple of minutes, but if you need anything, please call.
Okay.
Okay.
Mr. Graham, is it okay if I start getting your vital signs?
Whenever you have to perform a procedure, have all the equipment ready. This reduces the amount of time the person is involved in these procedures. As you provide care, observe for signs and symptoms of health problems and follow guidelines for preventing infection. When assisting with dressing, choose clothes that are comfortable and simple to put on, such as items that close with Velcro. Offer simple clothing choices. Lay clothes out in the order they will be put on and hand them to the person one at a time. Don't rush him.
With the short sleeves or the long sleeves?
This.
You want this one? All right. That's a good choice. All right, Barry, it's dinner time. Do you want to open up the lid and see what you get for dinner?
For any person with AD or other dementias, be sure to meet basic needs, following a daily routine.
Go ahead and pick it up.
Okay.
Good job.
For example, to meet food and fluid needs, provide finger foods and cut food and pour liquids as needed. However, reduce the intake of drinks with caffeine, such as coffee, tea, and cola.
You got butter for your cornbread. You've got salad with ranch dressing. Do you like ranch?
What is that?
That's dressing for your salad.
Play music during activities such as eating and bathing. As shown in other video skills, provide good skin care. Promote urinary and bowel elimination. Provide incontinence care as needed. Promote personal hygiene and provide oral hygiene. Adjust the environment as needed and take appropriate safety measures, such as posting picture signs and removing breakable items from the area. To help manage a person's wandering, follow agency policy for locking doors and windows while keeping fire exits accessible. Keep door alarms and electronic doors turned on and respond to door alarms at once. Make sure the person wears an ID bracelet, a wander alarm, or a Medic Alert Plus Safe Return bracelet if used at all times. To reduce wandering, involve her in activities such as folding napkins or watering plants, and encourage her to exercise as ordered.
I want to go outside.
Okay, we can go outside. Let me help you with that.
When a person wants to leave, don't use restraints and don't argue with her. If she insists on going outside, make sure she's properly dressed. Go with her and guide her back inside after a few minutes. Or let the person wander in enclosed areas if your agency has them. Such areas provide a safe place for wandering. With sundowning, signs, symptoms, and behaviors of AD increase during hours of darkness. To help cope with sundowning, perform treatments and encourage exercise and activities early in the day. Later in the day, provide a calm, quiet setting.
Mr. Graham, how does that snack look? To help hold you over till dinner.
Throughout the day, meet the person's need for nutrition and elimination, because hunger and the need to eliminate can increase restlessness. If sundowning occurs, don't restrain the person. Don't try to reason with him, and don't ask him to tell you what's bothering him. The person may not be able to understand you or think or speak clearly.
Shoo!
Miss Perkins?
Shoo!
Miss Perkins?
Shoo!
Miss Perkins?
Shoo!
Look at me. Do you remember me, Ellie, your nursing assistant? Hi. Are you okay? Listen, Miss Perkins, there's nobody there. It's fine. You're fine. You're in your room. Just you and me here.
To help deal with hallucinations and delusions, if the person is afraid or distressed, don't argue with her. Instead, provide reassurance that you'll protect her from harm. Try to comfort her and use touch to calm and help reassure her.
Yeah, now we don't have all that noise. Can you take some deep breaths? Good job. You want to put your glasses on? Do you want to put on your glasses and see a little better what's going on? Here you go, I'll help you.
Have the person wear eyeglasses and hearing aids as needed. As needed, also turn off any violent TV shows or movies. Eliminate noises that the person could misinterpret. Adjust the lighting to avoid glares, shadows, or reflections. Cover or remove mirrors. Make sure the person can't reach anything that she could use to hurt herself or others. And distract her with an activity such as going to another room or taking a walk.
All right, good job. It's going to be right out this door here.
To promote sleep in a person with AD and other dementias, plan the day appropriately. During the day, follow the person's exercise plan. Discourage naps and limit caffeine intake.
Tired.
It's not nighttime yet. It's only 3 p.m. It's only 3 o'clock in the afternoon. It's not time for bed yet, Miss Perkins. Do you know what? We have that dance class starting soon. You enjoyed that last week, remember?
Oh.
Let's get up and go to that dance class. It's fun to participate in.
Okay.
Okay.
Okay, you did a great job brushing your teeth. And we're going to go ahead and get ready for bed and get in bed like I said. But I did want to point out that I turned the night light on for you.
In the evening, stick to a regular bedtime schedule and follow bedtime rituals. To provide a quiet, peaceful mood, dim the lights, reduce noise, and play quiet music. Also, use night lights to help prevent accidents and disorientation.
There you go. Okay. And since it's a little bit later, we're going to go ahead and start getting ready for bed. And if you want to go ahead and start getting your robe off, you have a zipper. And I'll go ahead and get the other things and we'll get you ready for bed. There you go. And before I leave, I'll turn off the light. Make sure you have your call light. All right.
After providing care for a person with AD or other dementias, report and record your observations, including any changes in the person's condition. For detailed information, see the section on follow-up care, reporting, and recording in this program.